Hi, everyone. I am Tina Dale with the Fairfax County Health Department. Today, we are recognizing March 24th as World Tuberculosis Day, or what we call TB. And this is a recognition to raise public awareness about the health impacts of this disease and to step up efforts worldwide to end TB. March 24th, 1882, is actually the day that Dr. Robert Koch announced his discovery of the TB bacterium, the bacterium that causes TB, which opened up the way to both diagnose and cure this disease. And unfortunately, TB does remain one of the world's most infectious diseases, with approximately 4,100 people a day losing their lives to this disease. However, we want you to know that TB is both preventable and curable. Joining me today is Dr. Barbara Andrino. Dr. Andrino is a tuberculosis public health nurse with the Fairfax County Health Department. Thank you so much for joining us, Dr. Andrino, and happy World TB Day.
Well, thank you, and thank you for having me.
Thank you. So let's talk about tuberculosis or TB. So, is this an infection that we really should be concerned about both here in the United States and even in our own health district of Fairfax?
Tuberculosis continues to be a problem. It's one of the major infectious causes of death in the world. It was higher on the list till it was eclipsed a bit by COVID, but there will be a time when COVID diminishes and TB will be back at the top of the list again. Because TB is an infection that affects many people in the world, it also affects people here in Fairfax County. So we do have about a third of the cases of TB in Virginia are here in our county. And that's because we have many people in our county who have spent some time in their life in TB endemic countries. Fairfax County has a whole team of people whose job it is to evaluate people for TB and then to treat them if they have active or latent disease.
So, you mentioned both latent TB infection and active TB disease. Can you tell us the difference between the two?
Certainly. When someone inhales air that has the TB bacteria in it, that bacteria travels into their lung. And what happens for most people at that time is their immune system is able to recognize the bacteria and to control it. And at that time, because their immune system is healthy and the bacteria is controlled, they don't have any symptoms. So they're not aware that they've been infected with the TB bacteria. Time goes on and their immune system continues to control the bacteria. So, except for a TB test, there's really no evidence that they have been infected with TB. They have no symptoms, they're not contagious to others, and they don't really know that they have TB. So, we call that state latent TB. In some people, often later in life, for reasons that sometimes we understand and sometimes we don't understand, the TB bacteria can start to grow again and can overwhelm the immune system that's no longer able to control it. This most commonly happens in the lungs, where a pneumonia develops and people then become sick, most commonly with a persistent cough. People with active disease have many bacteria in their body. Some of them are contagious to spread the disease to others, and often they are very ill. They have symptoms such as fever, weight loss, night sweats, and often feel fatigued and are quite ill. So it's our goal at the county to identify people with latent disease and to treat them before they become ill, and for those individuals who have the symptoms of active TB to diagnose them if that's their disease. And if it is, then to go ahead and treat them and cure them of their tuberculosis infection.
Who should be concerned about TB?
Anyone who's spent prolonged time or traveled extensively in countries where TB is common should be concerned that they might have been infected with TB without knowing it during that time. People who have any kind of problem with their immune system, where they're not able to fight off infection as well, or people who are being treated with medications that suppress their immune system should especially be concerned, since they are at higher risk to develop active tuberculosis if they're infected with the TB bacteria.
So, for those who are joining in, I'm Tina Dale with the Fairfax County Health Department. Today is World TB Day, and I am speaking with Dr. Barbara Andrino, who is our tuberculosis public health physician here at the health department. So, my next question for you, you're talking about somebody who has latent TB. And tell us, if somebody is diagnosed with latent TB, what is the treatment?
So there are several regimens that we use to treat people with latent tuberculosis. This usually involves 1 or 2 drugs together for anywhere from 3 months to 9 months. Which treatment is best for any person is really something that's best determined by them and their physician when they look at any other health conditions they may have or other medications that they may be taking. Treatment for latent disease is available through people's primary doctor, and it's also available at the Fairfax County Health Department for those who are diagnosed with latent TB.
So, for those people who happen to have TB, um, I understand that there's potentially some misconceptions or myths out there. Can you touch a little bit on that?
Yeah, there's several misconceptions about TB that I hear. One is that there's no relationship between the fact that someone spent time in a TB endemic country, maybe 10, 20, 30, 40 years ago, and an illness that they may have at the present time. So they have a persistent cough now, and they don't think that there's any connection between that and the fact that they may have been infected with TB many, many years ago. Another misconception that I hear is that if someone has a normal chest x-ray, even though they had a positive test for TB, that they don't have tuberculosis. Tuberculosis is a bacteria. It's microscopic. It's not visible on a chest x-ray. A chest x-ray serves to tell us whether someone has a pneumonia or a lung infection with TB at that moment and whether they could potentially be contagious to others. It doesn't tell, however, whether they have living TB bacteria in other parts of the body or in very, very small microscopic amounts in the lungs. Both of those conditions, the TB bacteria still has the potential to grow and make them ill with TB later in life. The other misconception I hear is about a TB vaccination called the BCG vaccine that is used in many, many parts of the world. This vaccine is given to young children, and it is very effective at protecting very young children against devastating TB infection. Young children are not able to fight off the TB bacteria very well, and if they get TB, it can be devastating to them or even kill them. However, the BCG vaccine does not continue to protect people against becoming infected with TB or developing disease later in life.
So we talk about the symptoms. We've talked about how you would get treated for TB. What we haven't touched on is how do you actually find out if you have latent TB infection, if those TB germs are within your body. Can you talk a little bit about the tests that the health department or your physician would administer to determine if you possibly have TB within your body?
There's 2 main kinds of tests that are used. One is one that has been out a very long time, for many, many years. This is the TB skin test. This is where a bit of uh, purified derivative of TB is injected under the skin, and then it's measured and watched several days later to see if the immune system creates a reaction to it. The other tests that we use are blood tests that measure whether your body's immune system shows evidence of response or immunity to the TB organism. So we offer both of these tests. We tend to use at our health department the blood tests more often. because there is not any interference from the BCG vaccine with the blood tests. And so that's the one that we prefer, although both tests can be used.
Thank you. And Dr. Andrino, is there anything else we should know about TB today?
I think that one message I would like to get out is that TB is treatable and curable. Some people may be have had knowledge in the past or known people from many years ago who were infected with TB, who then died of the disease. And we want to let people that know that we have good medications to treat TB, that TB is treatable and curable, and that's our goal through our TB program, to identify those people who do have active disease, then to treat them until cure.
Thank you, Dr. Andrino. And I think that's a very important message, that TB is both preventable and curable. You just need to get tested early, and that there are treatments that the health department can provide to ensure that you do not progress to active TB disease. So thank you very much for a great discussion today on World TB Day. And for those who would like to get more information about tuberculosis, you may visit our website. That's fairfaxcounty.gov/health/tuberculosis. So for those who have questions about TB or want to get tested, feel free to contact the health department or reach out to your healthcare provider. And for all of those who have joined in today, thank you so much for watching, and we hope to see you again next time. Have a good afternoon, everybody, and thank you, Dr. Andrino.
Thank you.